ones who manage their blood sugars as best they can by taking massive amounts of insulin. And I heard from Dr. Ian Lake that there are diabetics who do that, who keep their blood sugar HbA1c in a good range by eating a high carb diet and taking big amounts or large amounts of insulin. So what's the problem with that? If that is something possible, if you can keep your HbA1c at a good level, having big variations in your daily blood sugars, because you're bound to have those variations, ups and downs and ups and downs, but the average, the HbA1c seems to be in a normal, healthy range, then what is it problematic?
Okay, so ideally, and I said that a normal functioning pancreas will keep glucose levels generally at a nice steady state. That's what the body likes and expects. And so, yes, it is possible to have a reasonable HbA1c on a high carbohydrate diet with a lot of insulin, but the risk is that instead of a sort of straight line, that your levels are going up and down and up and down. Now you might say, well, that doesn't really matter as long as you're not going into hypoglycemia. And that's the biggest risk of biggest fear, of course, and the biggest risk of having a lot of insulin. That's true, but then the other thing to be aware is there's quite a lot of evidence that some of the complications arising from diabetes are not just due to high glucose levels, they're due to changing glucose levels and big variations in glucose levels. And one of the commonest problems arising from changing glucose levels is to do with nerve function, because nerve cells in particular are very, very sensitive to changing glucose levels. And you know, people might have a reasonable HbA1c, but if their levels are fluctuating like that, it can trigger symptoms in, you know, neuropathic symptoms, pain, or, you know, abnormal sensations in their feet, or other nervous system problems. So but yeah, you might, if you are someone who has type 1 diabetes and you eat a high carb diet and you give a lot of insulin and you can avoid that fluctuation, then that's great. You found a way whereby you are able to match what your body needs with the right amount of insulin at the right time. You know, so in principle, that sounds great. In practice, what often happens in that situation is that over time, people begin to put on weight because they're acquiring a high amount of insulin, and insulin is a fat storage hormone. And as you put on weight, just like people with type 2 diabetes, you become quite insulin resistant. That means you need even more insulin to get the same effect. So over time, you can get to this situation where people with type 1 diabetes develop what is called double diabetes. They also have features of type 2 diabetes. They've gained weight, they might be obese, and they're insulin resistant. And that is and I've seen several people who've been in that situation. They may be in their 40s or 50s, they've had type 1 diabetes for 30 or 40 years. And if you look at their weight chart, it's just gone up and up and up and up. And that is already opening to a conversation. What I would say to people in that situation, the only way that I know that you can lose weight if you inject insulin is to inject less insulin. The only way you can inject less insulin without causing your sugar levels to go up is to eat less carbohydrate. So how about making that switch to a lower carbohydrate diet? And a number of patients of mine have done that, and they've lost 15, 20 kilograms in weight just by reducing their carbs. And not necessarily to a very low carb diet. But, you know, if you're having 300 grams of carbs a day, which is within a normal limit, actually, between 200 and 300 is where most people in Western societies, how many carbs they eat a day. If you're eating 300 and you halve that to 150, it's still not a low carb diet, but you've halved your insulin and you can achieve significant weight loss.